Beijing Chinese authorities plan to close off Wuhan, a city of more than 11 million people and the epicenter of a mysterious, pneumonia-like virus that has already spread halfway around the world, canceling planes and trains leaving the city beginning Thursday, and suspending buses, subways, and ferries within it. The announcement, shared on Chinese state media hours before it was to take effect, was a significant escalation from just the day before, when the authorities had urged people not to travel to or from the central Chinese city but had stopped short of shutting down transportation. The new virus, which first emerged at the end of December, has killed at least 17 people and sickened more than 540, including in Taiwan, Japan, Thailand, South Korea, and the United States. It has raised the specter of a repeat of the SARS epidemic, which broke out in China in 2003 and eventually killed more than 800 people worldwide after a rapid worldwide spread. In recent days, governments around the world have introduced special screening measures at ports of entry, and the World Health Organization is weighing the declaration of an international emergency. The Chinese authorities said that the measures in Wuhan, which would take effect at 10 a.m., were needed to effectively cut off the transmission of the virus, resolutely curb the spread of the epidemic, and ensure the safety and health of the people. They said they would announce an end date for the restrictions separately. The transportation shut-off was announced soon after 2 a.m., but news spread quickly. On Sina Weibo, a Twitter-like Chinese social media site, the hashtag #Wuhan lockdown was the top trending topic, with more than 1.6 million views. Chinese users left comments on the government's announcement expressing support for the lockdown and concern for the residents of the city. Go Wuhan, several posted. Others wondered how sick residents would get from their homes to hospitals without public transportation. Some who said they lived in Wuhan expressed worry about what would happen to them. Who will think of the lives of those of us who are healthy in Wuhan? We are also afraid, wrote one user, who described herself as a designer living in Wuhan. Even before the city was closed, we protected ourselves and hid at home. Now we are lambs who will still be slaughtered, and we can only leave our fates to the heavens. Extreme measures during outbreaks have been imposed elsewhere before. During the Ebola epidemic in West Africa in 2014, Sierra Leone ordered everyone in the nation to stay home for 3 days as the authorities went door-to-door checking for new cases, retrieving dead bodies and trying to stop the disease from spreading further. In Monrovia, the capital of Liberia, a sprawling neighborhood with tens of thousands of people was put under strict quarantine by the government and guarded by police officers in riot gear, setting off violent clashes with Pendayan residents. During the 2003 SARS outbreak, anyone in China who displayed symptoms of the disease was hospitalized, and students were examined daily. In Singapore, people suspected of having SARS were confined to their homes and monitored with webcams and electronic bracelets. Still, medical experts were startled by the scale of the shutdown in Wuhan, which has more people than the entire country of Sierra Leone. Dr. Tom Inglesby, director of the Johns Hopkins Center for Health Security, said that a city the size of Wuhan has tens of thousands of connections with the outside world that are coming and going all the time, bringing food and medicine. The complexity and downside cost of that will be potentially very high, he said. The sudden restrictions on Wuhan could upend the travel plans of millions of Chinese citizens, who travel in huge numbers during the Lunar New Year holiday. The government said it would shut down airports and train stations to departures, and urged residents not to leave the city, a major transportation hub, unless they had an urgent reason to do so. The Lunar New Year in China is the world's largest annual migration of people, with hundreds of millions of travelers fanning out across the country and the world, and hundreds of billions of dollars spent on hotels, restaurants, and shopping. Now, with the new coronavirus, the mass migration is also an epidemiologist's nightmare. The authorities are scrambling to control the disease, which has spread around the region, even reaching North America. The World Health Organization met on Wednesday to discuss whether to declare the outbreak an international health emergency, which would escalate the global response. Chinese officials had already classified the virus as a Class B infectious disease, a category that includes SARS. The virus has sickened more than 540 people in Asia and one person in the United States. International officials are stepping up screening at major airports. In the United States, all airline passengers from Wuhan, regardless of destination, would be funneled to one of 5 screened airports, an official with the Centers for Disease Control and Prevention told reporters. Before the virus emerged, the Chinese government had estimated that domestic travelers would make 3 billion trips over the holiday period, also known as the Spring Festival. But on Wednesday, a senior health official delivered a stark warning: the tide of travel during the holiday would make it more difficult to contain the outbreak. In addition, the official, Li Bin, a deputy head of China's Health Commission, said, the possibility exists that the virus could mutate, and there are risks that the epidemic could spread further. Many Chinese have already cancelled their travel plans, foregoing vacations and what for some is their only chance to return home for family reunions during the year. The Lunar New Year, a week-long holiday, begins on Friday, when the country says farewell to the Year of the Pig and welcomes the Year of the Rat. After we heard how bad the situation was on Monday, we held a family meeting and decided that it just wasn't worth the risk, said Yan Chaoei, 32, a Shanghai resident who was planning on taking a 7-hour bullet train to her family home in southeastern Jiangxi province. It just wouldn't be a relaxing trip, especially with a small child, she added. When we finally made the decision to stay home, we sighed with relief. Even some working in the travel industry were nervous. Flight attendants at Cathay Pacific, Hong Kong's leading airline, publicly lobbied the company to allow them to wear masks during all flights, a request that was granted on Wednesday. It will be too late and too painful for all of us and the company to wait until one of our own is infected, the airline's union for flight attendants said in a statement. The damage caused will be catastrophic. In Wuhan, which is popular among tourists for its colonial architecture, spicy noodles, and proximity to the Yangtze River, the authorities had already issued a ban on large public gatherings and performances at hotels and sightseeing destinations. They had also announced that all locals were required to wear masks in public to help prevent the spread of the virus. To encourage travelers to stay away from Wuhan, tour companies promised penalty-free refunds for hotel bookings and air and train tickets to and from the city. Travel operators suspended itineraries with stops there, raising concerns of a slump during what is usually one of the most lucrative weeks of the year. For Chinese companies, the outbreak could deal yet another blow at a time of slowing economic growth. According to official estimates, Chinese spent $74 billion on travel and $145 billion on shopping and food during the Spring Festival holiday last year. The holiday is also one of the most profitable periods for the Chinese box office, but there are concerns that potential moviegoers might stay home to avoid sitting in enclosed spaces with strangers. Many also take advantage of the week-long holiday to travel abroad, particularly in the region, but may be forced to change their plans this year. Tsai Ing-wen, Taiwan's president, said on Wednesday that all travel by tour groups between Wuhan and Taiwan would be suspended, a day after her government confirmed the island's first case of the new coronavirus. In Hong Kong, one of the biggest travel agencies said it was cutting all tour groups to, or passing through, Wuhan until the end of March, according to news reports. Airports around the world have stepped up screening measures for travelers arriving from Wuhan. The health authorities in Hong Kong are also requiring airlines to distribute health declaration forms and to make face masks and antiseptic wipes available at boarding gates for passengers arriving from Wuhan. Experts have warned that with the travel rush already underway this week, the virus's continued spread may be inevitable. Zhong Nanshan, a prominent scientist who is leading a government-appointed panel of experts working to control the outbreak, singled out the cramped train rides that many Chinese have to endure during the holiday as potential hotbeds of transmission. Some international health experts, including the World Health Organization, have praised the Chinese government's response as timely. But the government, particularly in Wuhan, has drawn public criticism at home for what some see as a delay in the reporting of cases that evoked the memory of a 2002-3 outbreak of SARS in which the Chinese government withheld critical information. A top committee of the ruling Communist Party warned officials on Tuesday in a social media post that anyone who sought to hide infections would be forever nailed to history's pillar of shame. Outside of China, countries including the United States and Australia have stepped up screenings and security measures at airports for travelers coming from China. Experts say there is still a risk that the symptoms of the virus don't become apparent until after the sick have crossed a border, as was the case in the United States, where the first confirmed case was a resident of Snohomish County, Washington, who had recently traveled around Wuhan. In Mexico, President Andrés Manuel López Obrador said Wednesday morning that the Mexican health authorities had identified a possible case in the northern state of Tamaulipas. The patient was under observation, the president said during a news conference. Gloria Molina, the health secretary for the state of Tamaulipas, said that the patient is a 57-year-old researcher in a university biotechnology laboratory who had visited Wuhan recently and works in Reynosa, a border town that abuts McAllen, Texas. Despite the spread of the virus, some experts are urging the public to remain calm. This is a SARS-like event but not as severe as SARS, said Wang Linfa, director of the Emerging Infectious Disease Program at Duke News Medical School in Singapore. During an outbreak like this from an unknown pathogen, overreacting might be better than underreacting, but we still have to be realistic. Junian Cheng, 19, a chemistry major at a university in Wuhan, appeared to be heeding that advice on Wednesday as he sat on a suitcase outside a Beijing train station smoking a cigarette. "Don't worry, I'm not going to Wuhan," he said, as a phalanx of People's Liberation Army soldiers in green uniforms and black face masks marched behind him. Asked if he was concerned about his classmates back in Wuhan, the teenager laughed and said, "I'm not really afraid. We just make fun of each other on WeChat, like, yo, you still alive?" Amy Chin reported from Beijing, and Vivian Wang from New York. Reporting was contributed by Christopher Buckley from Beijing, Ronnie Karen Rabin in New York, Kirk Semple from Mexico City, and Tiffany May, Ezra Chung and Elaine Yu from Hong Kong. Zoe Mao contributed research from Beijing, and Claire Fu contributed research from Chengdu, China.